welcome to the meeting, everybody, those who are in the room and those that are online. And it is the first Health and Wellbeing Board of the municipal year. So before we start, can I bring to your attention the usual housekeeping matters? There is no expected fire alarm testing today. Therefore, if the alarm sounds, please follow the fire and emergency procedures that are applicable to the Council House. This meeting will be broadcast live to the internet and will be capable of subsequent repeated viewing. By entering the Warspite room and during the course of the meeting, committee members are consenting to being filmed and to the use of those recordings for webcasting. Can I ask that you please speak clearly and directly into your microphone when addressing the meeting so other participants and the public can hear, and that you switch it off when not using it, and mobile devices are turned to silent. May I also give a warm welcome to Sharon Muldoon, who joins us as the new Director of Children's Services. I think Sharon is online, isn't she? She replaces Alison Botham, who we have recently said goodbye to, and tribute has been paid to her many years of service for Plymouth and local government generally. So welcome to you, Sharon. Next item, number 1. It's a bit odd to be noting your own appointment as chairman, or chair, but that's what I think we're being asked to do. Moving on to item 2, we do need a vice chair, but as none of the other permanent members are able to be here today, I would like to propose that we defer the choice of a vice chairman until the next meeting. Can I propose that? Do I have a seconder? Thank you, Jemima Lang. And everyone in agreement? 3 of us, presumably. Can I ask Democratic Advisor which I think is Elliot, to give any apologies?
Yes, Chair. So we have a few. We have apologies from Councillor Patrick Nicholson. Councillor Watkin will be substituting today. Apologies from Councillor Aspinall, who's attending online. Apologies from Councillor Sue MacDonald. Councillor Lang is attending as a sub. Apologies from Ruth Harrell, Director of Public Health. Rob Nelder will be deputising today. Apologies from Craig McArdle, Strategic Director for People. Anna Coles will be deputising today. And apologies from Sheila McCormick, who's attending online.
Thank you, Elliot. Ross, is there nothing at this point you need to say?
Well, I will say it briefly, Chair. This is a local government committee, so it's governed by Section 102 of the 72 Local Government Act. What that does mean is that colleagues joining us online are essentially not attending this meeting, and therefore are unable to vote or actively raise recommendations or shape them. There was some flexibility last year, but unfortunately that's now been removed. So we'll just need to keep an eye on voting, Chair, but I don't anticipate that being a problem today. Thank you.
Thank you, Ross. Item 4, are there any declarations of interest? No. Under item 5, Chair's urgent business, I would like to make a statement which is brief, and as you will see, the issue will be being discussed at the Health Scrutiny Panel in 2 weeks. But I would like to say, following the debate at the City Council meeting on the 20th of June about the ambulance response times, it has become more apparent that there are major issues with the performance of the 111 out of hours service. These issues are being discussed at high levels in the city and beyond between stakeholders with the aim of improving the service for our residents. There will be a full presentation around urgent care and issues involved at the Health and Adult Social Care Overview and Scrutiny Committee on the 13th of July, followed by questioning by councillors and others. We are all committed to working towards improvement in all the interrelated areas of the health service for the benefit of patients in our city and the wider area. Does anyone want to comment on that? Jemima.
As the proposer of the motion that we talked about at Council, I'm looking forward to that meeting and to that presentation, and I'm glad that recommendation has been responded to so quickly. Thank you.
Thank you. Item 6, minutes. I think you all have a copy of the minutes. there is one slight amendment that needs to be made, and that is under apologies for absence. It should read Councillors Downey and then Dr. Sheila McCormick and Michelle Thomas. So we will be amending them in due course to that effect. Are there any other issues that anyone has picked up from the minutes? No. So can I propose that with that amendment, I will sign them as a correct record? Can I have a seconder, please? Tony, thank you. Everyone in favour? Thank you. So we'll move on now to questions from the public, of which there are none. So briefly, we will go into item 8, and I will ask Julie Fryer, who's a consultant to public health medicine, to give the report of the Devon and Cornwall Isles of City Health Protection Report. Welcome, Julie, and thank you.
Good morning and thank you. Today I'm bringing to the board the annual Health Protection Assurance Report for the Health and Wellbeing boards across the peninsula from the annual Health Protection Committee, from the Health Protection Committee. You've had the report, so my proposal is just really to go through the report and share some highlights from it, and then take any questions if required. Every year we bring a summary assurance report. This report covers the period April 20 to March 21, so now feels quite historic in that context. Although the report does, because it has a time lag because of the getting the annual reporting data, we have in it referred to activities undertaken in 2021 just to provide a more timely picture and continuity. The report comes because the Health Protection Committee is mandated by all the health and wellbeing boards in the peninsula to undertake an assurance role and then provide a report to the board. Just to note that PHE changed in October 21 to the UK HSA, and so we've referred to both titles just to avoid confusion during the report. It goes without saying, really, that this report came, in a sense, just as COVID hit. So we went into lockdown kind of the end of March, and this report covers that year. So a significant part of the report is focused on the COVID-19 response. And that activity in the first section really describes some of the highlights and the sheer amount of work that was done across the system, and provides us, in a sense, an assurance update on the kind of a range of activities that were put in place to respond to COVID-19. And I'm sure, you know, in real time, the board have had COVID-19 updates from a local authority perspective and a system perspective in the meantime. PHA, UK HSA are there to provide the kind of leadership around outbreaks and of disease, including COVID-19. And the first table really just sets out the context of the number of incidences that were responded to in that year. This is a significant underrepresentation because the local authorities, public health teams also realigned, in a sense, to provide a significant amount of setting to support to settings across the system. And then the kind of other areas are that communicable diseases other than COVID still existed during that year, and PHE provide support, or UKHSA as now, to provide support to a range of different activities, and a couple of highlights there are shown. We have included some areas of good practice that really cover the COVID-19 response. So the amount of new advice, guidance, tools that were set up in order to provide support to the system, including webinars, checklists, risk assessment tools to help support and settings to manage what was happening for them. Contact tracing was set up, and there was a significant amount of activity around test and trace, interpreting new guidance as time evolved over that year. We, as a system, put together a regional testing strategist so that we could align and make sure that our practice was shared across the patch, and then there was targeted community testing both at fixed and mobile sites. We continue to roll out vaccinations and to look at outreach and other models to make sure that we're reaching all the population that we can, including those that may find it more difficult to access the mainstream offer, and to support communities around engagement and vaccine confidence. Infection prevention control. We were lucky in Devon in the sense that we had just at that point put together and commissioned a community infection management service. The aim was for that service to provide support through the health and social care around other infections such as E. coli and help with their infection prevention control. And we had that in place to move and realign that to really support the COVID-19 response. That meant we were able to develop good areas of new practice, such as the virtual tours in care homes that were experiencing outbreaks, so that we could get really good eyes on infection prevention control. And do that as a multi-agency group, helping support that system to manage what was happening for them. So that was really has served us well over the time. In addition, we're recognising how good it was to have infection prevention control into health, advice into health and social care setting. We recognised there was a need for other settings, and so another example of the practice that we developed during this time was to pull together 2 infection prevention control nurses across the 3 Devon local authorities, so Devon, Plymouth and Torbay, and use that resource to provide a similar service to schools and businesses and other settings. PPE, we obviously had to do a lot of work around that, and then provide support to settings when outbreaks were happening. And new and productive relationships and ways of working were really developed to help that. And then we needed to communicate and support, and so the local outbreak engagement boards were in place, and all systems developed, COVID champions and neighbourhood support and align the voluntary system so that there was a good response across the system to COVID safe measures. Meanwhile, we continued the normal surveillance, so the next section of the report really sets out the monitoring that was being done through that time to make sure that we were on top of other infectious diseases as well. The next section of the report really reports on the screening programmes during that time. Obviously, a lot of programmes were ceased and then had to be brought back on. And this section really sets out across those many screening programmes what happened during the COVID situation and then the recovery. And as you can see, a significant amount of work was coordinated by NHS South West with the service providers to bring those back on track and to bring those on in line with the NHS recovery programme timetable. Immunisation programmes, similarly, the childhood programme didn't cease and the performance was maintained, and NHS South West continued scrutiny of that by looking at real-time data sets, making sure that if people, there might have been a time lag with the kind of system pressures that were there, but things were maintained and if necessary investigated, so there was assurance around those. The school age immunisation programme was obviously quite severely impacted because lockdown meant that schools closed between pretty much from spring right through to autumn. And the scheduled vaccination programme that was due to happen in those terms obviously then rolled into the additional year. The next year there was another period of school being out from January to February, so there was significant disruption there. But the Devon programme has been continued, catch up and additional clinics have been laid on, and business cases have been developed, overseen by NHS South West to increase the workforce and the opportunity for community and catch-up clinics for those cohorts. Other vaccines included those in pregnancy, older people and flu. Just to note that the flu vaccination programme worked well. We've got a new system across Devon to oversee that, combining COVID and flu as a seasonal programme, and uptake was maintained. The healthcare associated infections, this is where the community infection management service would put their had been brought in to put their energy. Obviously, that was diverted to COVID, and that's documented here. Nevertheless, cases were monitored and patterns sought and interventions in the immediate were made. And that's where the new focus, as we come into recovery, we'll go back to. Emergency planning and response, well, obviously that was tested in the COVID response. And you can see that continued assurance activities were carried out during that time, as well as the COVID response being made. Section 8 details some of the work programme priorities that we had for that year and the progress against them, which I've kind of summarised as we've gone along, and sets out our new kind of work programmes for 21-22, which obviously align to maintaining the COVID-19 response and recovery system, as well as focusing on inequalities and some of the actions that we learned and experiences that we had addressing inequalities through things like the outreach vaccination programme. The appendices provide more detail of the kind of system that sits around assurance, and then some of the performance data for 2021. So I hope that that report provides a detailed analysis of the assurance process and activities that were there during 2021, and some flavour of the work that was done during that year. Thank you.
Thank you for that report, Julie. I mean, it was a very difficult year, including the 2 major lockdowns, and I think tribute needs to be paid to all the agencies in the health service and elsewhere who kept the country running at the level that was required and initiated. Of course, the vaccination programme came in, COVID vaccination came at the end of that year. So thank you for that report. And do I have any questions? Jemima.
Yeah, thank you, Julie. I've got a couple of questions, if that's all right, Chair. On the breast screening section, it says that the impact on uptake and coverage is not yet possible to determine, and I wondered whether also they were going to be looking into whether the delay in screening had any impact on diagnosis and treatment, and whether that's part of what will be looked at in terms of breast screening.
So the NHS South West have programme boards overseeing all of the screening programmes, working with providers. So they will be, and there are a whole series of KPIs beyond just coverage, but how the whole system works, and they scrutinise those on a regular basis.
And may I ask another more sort of general question, actually, about COVID vaccination in general? I mean, I know we're looking back with this report, but I'm just not clear personally, and I've had a couple of inquiries from residents around the COVID vaccination programme going forward. You know, I've had 3 jabs, but I don't know what the plan is for the programme going forward. Are we to be vaccinated annually, or what? I don't know. I honestly don't know, and I've looked and I've tried to find out, and I just thought this might be a good place to ask.
We're awaiting further detail around that, so I can update the board as we become aware of it in terms of the specifics going forward.
Thank you. I mean, there is a feeling that we will be having an autumn booster programme, is there not, possibly linked with the flu vaccination? Is that the sort of way the wind is blowing?
I think we would be looking towards understanding and planning for something, you know, some sort of programme, the precise details of which we're not, you know, there are indications but not confirmation, but we are definitely working and planning for that.
Thank you. Does anyone else have any questions? And I have one, Julie, and I think you've already answered it to me in an email. It was raised to me a couple of weeks ago that we appeared in the Sun as one of the lower areas for the polio booster programme to teenagers. I mean, this is on the back of the polio virus being found in sewage in London, but as far as I know, no confirmed outbreaks. And there might be many reasons for why it was found in the sewage. we were one of the lower areas. It was obviously a difficult time, as you've said, with teenagers not being at school. We are endeavouring to catch up, presumably, and presumably because it is only the booster and they've all had their primary programme, there is not a great risk at this moment that those who are a year late, whatever, with their boosters are going to suffer. I mean, the same applies to the HPV vaccine. I think there's been a delay, but we are having a programme to catch up.
That's correct. The NHS South West are working with the providers to look at catch-up clinics both in schools and community, and have funded additional workforce capacity to continue that catch-up, if you like, for those 3-year cohorts as indicated in the report. We have, in terms of the primary vaccination coverage for the childhood immunisation, always done very well in Plymouth, maintain high coverage rates of that, have maintained high coverage rates of that, and continue to be above the English rates for those. So the primary coverage is good.
Thank you. Are there any? Yes, Jemima.
Sorry, just one last question. And again, I wouldn't expect it to appear in here, but seeing as we're talking about infectious diseases, I just wondered whether we'd had any incidents of monkeypox here, and whether that is something that we ought to be worrying about or thinking about at this board.
That's being surveyed by UKHSA, and if they will lead any response to that, and there are full systems and processes to do that were that to be necessary. So we are doing all that needs to be done for, in line with what's coming out from the national and regional surveillance, if you like, from the UKHSA.
Have we had any instance of it in Plymouth?
Sorry, can I just answer? Yeah, I mean, I think as a public health team, as Julie says, we're working with partners to make sure we're fully appraised on the situation. But what we couldn't do in a public meeting is talk about numbers of cases and those sorts of things, because as you can appreciate, numbers are very low, and therefore you run the risk of breaching confidentiality and those sorts of things. But yeah, so it wouldn't be appropriate to talk about specific numbers in a public forum such as this. But maybe myself and or Julie or Ruth, when she's back, could have a conversation with you if you would welcome that.
Thank you. Are there any other questions on this item? No? Well, thank you very much for presenting that report. We will now move on to item number 9, the report of the Director of Public Health, which Rob Nelder is going to deliver before going on to part 2, which is a presentation on Thrive Plymouth Year 7, looking forward to 22-23. So, Rob, perhaps we could have your first half of the report and then questions, and then we'll go into the second half.
Great, thank you.
Thank you.
So, I mean, obviously the first thing to do is to apologise on Ruth's behalf for the fact that she's not able to, Ruth Harrell, who's not able to be here today. As probably the board are aware, Ruth is off at the moment, recovering from surgery. Hopefully she'll be back with us, back in the office working as normal from next week. So I'm just going to talk briefly through Ruth's Director of Public Health annual report that some of you will have seen already, because it was actually published a few months ago, but I think it's the first opportunity that we've had to bring it to the board, and it does sort of go seamlessly then, as the chair has said, into talking about Thrive Plymouth Year 7. So by way of conversation about the annual report, what normally happens is that that Ruth's annual report would focus on basically the previous year of the Thrive Plymouth programme. And I'll say a bit about the Thrive Plymouth programme in a minute so people are aware of what that is. But obviously the challenge this year has been that we had to put the Thrive Plymouth programme on hold because the entirety of the public health team and colleagues in our directorate were busy responding to the COVID-19 pandemic. So the focus of Thrive Plymouth Year 6, the intention was that it would focus on culture, heritage and health, and would tie in beautifully with the Mayflower 400 year. And we had plans for that year, but as I say, we had to put those on on hold. So this annual report really focuses on a bit about Thrive Plymouth and the background to that, a bit about the pandemic and our response to that, section on mental wellbeing and some of the work that the Health and Wellbeing Board have led on that, and then a bit of a look ahead to a bit of a look ahead to Thrive Plymouth Year 7. So, you know, as I said, we as a public health team had to put on hold our plans for Thrive Plymouth and focus on responding to the pandemic along with partners in the city. And I think that the fact that we've had Thrive Plymouth in place for a number of years meant that we were in a good place to do that, because Thrive Plymouth is all about partnership working too. So just to take you briefly through the report, as it says, Thrive Plymouth was adopted by Plymouth City Council in November 2014, and it is the citywide approach to addressing health inequalities and improving health and wellbeing. There are three approaches that underpin Thrive Plymouth. One is population-based prevention. So the idea that if we can encourage the city's residents to all make a small change to their lifestyles, then the cumulative impact of that will be quite large. So it's all about this, what they refer to as the sort of cumulative impact of marginal change. If we all make a small changes to our behaviours, then the impact of that overall on a citywide perspective could be quite large. It's also based on the common risk factor approach as it's described. In other words, the basis, you know, one unhealthy behaviour can lead to many health effects, and also the fact that what we shouldn't do is treat people in silos. So we shouldn't just see a smoker, or we shouldn't just see someone who drinks to an unhealthy level, or we shouldn't see someone who has an unhealthy diet, or someone who doesn't take enough exercise. Those behaviours tend to cluster in individuals and in individuals in areas of the city. So we need to be able to respond to that. So seeing the whole person rather than just seeing the behaviour of an individual. The third thing is the context of choice, and that's all about acknowledging that the healthy behaviour isn't always the easy behaviour. Sometimes it's much easier to take the unhealthy behaviour. I was trying to think of an example of this to give to you, and probably the easiest one is, as we are now going back into meeting face-to-face in buildings, then very often if you go into a building that you're unfamiliar with, you're greeted at reception, and the person behind reception says, your meeting's on the second floor, the lift's over there. What they don't say is, your meeting's on the second floor, the stairs are over there. So we're just encouraged to take the unhealthy choice sometimes, so we just need to reframe that a little bit if we can. So talking about the background to Thrive Plymouth, I won't go into this in too much detail because some of you are aware of it. The sort of construct, if you like, we came up with, which is based on 4 behaviours that lead to 4 diseases that are responsible for a large number of deaths in the city. So those behaviours in shorthand are smoking, drinking, eating and moving. Okay, so those 4 behaviours lead to 4 diseases: coronary heart disease, stroke, cancer and respiratory problems, that together are responsible for 54% of deaths in the city. That's the construct, if you like. So if you hear people talk about 4-4-54, that's what it's all about. But we needed to move from a construct to a campaign or a programme, and that's where we came up with the idea of Thrive Plymouth, because thriving is all about achieving, people doing the best, you know, being the best that they can, and it's much more positive than a numerical based construct. So that's what the campaign, if you like, is, and the programme is all about. We also recognised, of course, the importance of mental well-being, and so in Ruth's report there's quite a simple illustration that highlights that really good mental well-being is about that balance between your own personal resources and the challenges that you face as an individual. And what each of us need to try and do is try and keep our own mental well-being in balance, because we have, as an individual and as a society, you know, resources to support us, but we often face challenges at different times. So please don't think that mental well-being is overlooked just because it wasn't in that initial construct. Mental well-being is writ large throughout Thrive Plymouth. And we came up with a strapline as well, which is about positive choices for better health in a growing city. That's what we want to achieve through Thrive Plymouth. As I said, Year 6 was launched on the 29th of November 2019. It coincided with the Illuminate Festival at Royal William Yard. We had great plans for the year, but as you know, they were scuppered by the pandemic. So basically, our plans for year 6 were put on hold, and for the last 2 years, Thrive Plymouth, if you like, has been on hold. But Abs, in a minute, my colleague on screen is going to tell you a bit more about the plans for year 7 as we're now able to move forward. So just a couple of headlines about the pandemic that you're probably all aware of anyway. It was actually Friday the 13th of March. What a great day! Friday the 13th of March 2020, when we had our first case of COVID-19 confirmed in Plymouth. And then, as you're all aware, shortly afterwards, on the 23rd of March, there was the first national lockdown. In terms of some of the impacts of COVID-19, just to highlight those very briefly, there's been the direct impacts that we're all aware of, infection with COVID-19, that probably many or most people in this room have succumbed to. There's obviously a short-term illness that could include hospitalisation, long COVID, and of course, sadly, a number of deaths. In terms of the indirect impacts, there have been impacts on those 4 health behaviours: smoking, drinking, eating and moving. Probably we all know that our own behaviours with regards to those have changed probably quite significantly during the period of the pandemic, and in particular during the lockdown periods. There have been impacts on mental health. Vulnerable groups have been particularly impacted, and obviously people's lived experience has been impacted during the pandemic. And of course, there have been impacts on the changes to access to healthcare, income, school and education, and access to, as well, to the built and natural environment. And also, sadly, as we know, COVID-19, like many other infectious diseases, has highlighted inequalities, and its impact has discriminated in particular on those people who have underlying health conditions or disability, those people living in areas of deprivation. It's impacted upon housing, people living in poorer housing with lower incomes, and people from certain ethnic groups have been impacted disproportionately by the pandemic as well. Conversely, and quite clearly, the likelihood of mortality from COVID-19 has been lower among people who are wealthy, people who work from home, people who live in good quality housing, have no underlying health conditions, and are of white ethnicity. So COVID has discriminated on the basis of some of those, on the basis of some of those things. One of the other highlights in the annual report, in Ruth's annual report, is around mental health. A mental health needs assessment was produced, presented to this Health and Wellbeing Board. It highlighted what was known nationally and locally about the impacts of the pandemic on mental wellbeing in the city. I won't go into all the detail of that because there's a huge amount in the report, and I'm conscious we want to talk about moving forward, not necessarily dwelling on the last 2 rather unpleasant years. But we have to acknowledge that the impact of COVID has been significant on mental health, and has highlighted the importance of promoting mental health and tackling mental ill health at a population-wide level. And to support that, as part of the work that the Health and Wellbeing Board did, then the Health and Wellbeing Board members signed up to the Mental Health Concordat, which is referenced in section 3.4.4 of the report. In terms of ongoing developments, looking a bit to the future in relation to mental health, the ethos of Thrive Plymouth, as I've already said, is about supporting people to maintain and improve their mental wellbeing where it might be at risk. We've got ways that we do that in the city already through the development of the wellbeing hubs, workplace wellbeing offers, the 5 ways to wellbeing, and where services are needed, we need to ensure that the offers are designed to support people as and when they need it. And certainly additional capacity is being developed through online offers as well, because obviously as a result of the pandemic, more people have become more used to dealing with online offers. So we have to get into that space as well. Just to finish off, as I say, I don't want to go right through Ruth's annual report. There are a lot of examples in here about people's lived experience of COVID, of pandemic poetry. There's an example of a poem in here. There's opportunities for people to submit their experiences of the pandemic to what's known as the Corona Files, a journal of the pandemic year. So please, if you haven't already, take the time to explore those things. In terms of the next steps for Thrive Plymouth, bear in mind this report was put together towards the latter part of last year and sort of in the early part of this year. So there was still then, maybe as there is now, a bit of uncertainty around COVID-19. It hasn't gone away. You will have seen from the media that numbers are increasing again. We are always on the lookout for new variants. We don't know what the winter will bring. And we're also in a time of considerable economic uncertainty, and that in itself is likely to exacerbate inequalities. So with that in mind, with those things in mind, in the spring just gone, I think it was in May, we launched Year 7 of Thrive Plymouth, which is really considered as a year to sort of regroup, redouble our efforts to tackle health inequalities in the city. So that's really a summary of Ruth's Director of Public Health annual report. I'm happy to pause there if you like before Abs comes in and talks about the detailed plans for Year 7 and gives you more of an overview of that.
Thank you very much, Rob, for that report, which hopefully leads us to look into a more uplifting future after, as you say, a difficult couple of years. But of course, there are various aspects of the COVID pandemic still with us, both in infection terms and the result on people's health and mental health that have been impacted during that time. So thank you for that report on behalf of Ruth. So do pass thanks to Ruth as well. Any questions? Kathy?
Looking at Thrive Plymouth, it concerns, excuse me, I'll just have a drop of water. It concerns me that the retailers offer a lot of junk food, basically, that's very cheap, very easy to get hold of. Do you have any influence at all with retailers as to what they sell?
Okay, sorry, I thought there was a yeah. So yes, we do, and myself and Abs, who you can see on the screen there, bottom left, work very closely with our colleagues in the planning team in the Place Directorate in the City Council. So there are a number of things that we've done and have put in place as part of the joint local plan. Just to give you one example, in the joint local plan, there are now restrictions on new hot food takeaways being opened or established within 400 metres of secondary schools. So from a public health perspective, any new planning application, be it related to food, be it related to any building, then Abs and I scrutinise those when they come in as the sort of consultees. It's very difficult for us to I suppose influence what is sold once a hot food takeaway, for example, has been allowed to open. But what we have done quite successfully over the last couple of years, since we got that statement in the joint local plan, is to be able to argue against some hot food takeaways being allowed to open in certain parts of the city. So really, our influence on that is through the planning mechanism.
Do you want to come back on that, or thank you, Jemima?
Thank you, and thanks, Rob. I'm thinking particularly about clinically vulnerable people who were shielding during the pandemic, and I know as the world's sort of returning to normal in inverted commas, there's still a lot of people in our city who don't feel able to do that. We're a trauma-informed city, and I can think of people off the top of my head for who actually setting foot outside their front door is still a trauma for them, because they have an underlying illness which could make them particularly vulnerable to COVID, even if they're vaccinated, etc. I just wondered what work we're doing as a city to identify and support people who aren't able to return to the world in the way that a lot of us have been able to.
Yeah, thank you. I mean, that's one of the things that we as a public health team are acutely aware of, because there are a number of people in our team who fall into that very category. So that fact is not lost on us. I think the challenge we have, I haven't got a specific answer to you. The challenge we have is to make sure that that group of people aren't left behind and aren't lost behind their front doors. So I think as a society, what we need to do is be aware that that group of people exist, that they're scared, and that you know, whilst it's okay for maybe the population at large to think that the pandemic has gone away, it clearly hasn't. There's a lot of, you know, to coin a phrase, there's a lot of it about in terms of COVID at the moment. We have got our community connections team who work very closely with vulnerable groups in the city, as well as we do in public health. And we've also got more work that we're doing within the public health team to engage with vulnerable groups in the city. But I think what we're going to need to do as we hopefully move out of the pandemic, and I don't think we're there yet. As we move out of the pandemic, we need to come up with a way to do exactly what you're suggesting, which is to make sure these people aren't left behind and, you know, don't live their lives in fear.
I just wondered if, I mean, I know the work programmes for Thrive, etc., are set and things, but whether that is something that could be borne in mind for future programmes, to look specifically at that group of people and how we can support them, because we know isolation is an issue for a whole host of people in the city, but I'm thinking particularly about clinically vulnerable people, what we can do to support them. Thank you.
Yeah, I think that's absolutely right. One of the strengths, I suppose, of the Thrive Plymouth programme, you know, it was initially a 10-year programme. We've lost 2 years, so ultimately it will still be a 10-year programme run over 12 years, if that makes sense. But what we never did at the start was say, right, year 1 is going to be this, year 2 is going to be this, year 3 is going to be this, etc. So we still don't know what the focus of future years are going to be. And there are things that come up that cause us to respond and make them the focus of future years. So, yeah, I suppose what I'm saying here is that you know, we've got year 7 that we're working on now, but years 8, 9, and 10 are very much up in the air, and we could choose the focus of those to be whatever we deem is appropriate for us as a city.
Thank you. Tony.
Yeah, I mean, you're absolutely right. I mean, I suppose one thing I would say is whilst Thrive Plymouth is the sort of citywide programme to address health inequalities and improve health and well-being, there are also a huge number of other things that go on that are led by the council and supported by partners in the city. So just as an example, we've got the Child Poverty Action Plan, and one of the areas of focus of that Child Poverty Action Plan is looking at issues around cost of living and those sorts of things. So although it may not necessarily at this point in time be writ large in Thrive Plymouth isn't the only thing that's going on to address those sorts of things in the city. So I mean, you know, the Child Poverty Action Plan's got a plan on a page, and that's probably where a lot of that work will be done. And also, I mean, bear in mind, as I say, that other partners as well will be acutely aware of that issue, because it's affecting everyone.
Thank you, Rob. Kathy, another question.
Yeah. Going back to Jemima's point, I endorse what she said absolutely, and I've come across elderly people who are not particularly vulnerable, but who are still afraid to go out. But they sit watching their televisions and hearing all about the, all the infection rates at the moment, and it's not very clear whether people are seriously ill or whether they've, just got a bad cold. And I think possibly if there was some, if you actually stated if it was less serious, then people might feel a little bit more comfortable about going out.
So I think what we need to bear in mind is that COVID, when it first came out, was a novel disease. Okay, it didn't exist before, and I think it affects different people in different ways. So although the Omicron variant was or is, because it's the current dominant variant, although the Omicron variant is less, it seems to be less severe than the previous Delta variant, I don't think what we can say is it's just like a bad cold, because for some people it's way worse than a bad cold. And I think what it would be inappropriate to do is say that don't worry about it, because you don't know as an individual how it will affect you. Until you've had COVID, you don't know how each of the variants is gonna affect you. And there are probably people around this table who may have had COVID and may have had a very mild illness. There are probably people around this table who've had COVID and have been absolutely floored with it. So I think although Omicron overall is less, would appear to have less severe impacts than the original Delta variant, there are still people dying of COVID. There are still people being hospitalised. There are still people getting long COVID. So we just have to be really careful with those messages, I think.
Thank you, Rob. Are there any other questions? Nobody online? Oh, Jemima.
Just a quick one about long COVID, actually. Again, just the same ask, I suppose, around the Thrive future years, whether the impact of long COVID can be woven into that somehow too, because that's something that's coming up more and more actually in my inbox as a councillor with queries from residents.
Yeah, I mean, I'd be very surprised if a future Thrive Plymouth year did not focus on those pandemic impacts that we've talked about today. I mean, I think, whilst we're still in the pandemic, we're trying to, as you'll see from Abs in a minute, we're trying to have almost like a regroup year. And as you're aware, the NHS is doing what it can with long COVID clinics and those sorts of things. But I would be very surprised going forward if there wasn't a how do we get over the impact of the pandemic? It wouldn't be called that, obviously, type year, be it year 8 or whatever, because as you've quite rightly highlighted, the impacts on the clinically extremely vulnerable, the impacts of long COVID, they're there for a long time. And as a city, as a public health team, as a society, we need to be able to respond to those and support our residents in getting through some of those issues.
Thank you. Shall we move on? So Abina's going to present from the teams, from the screen, part 2, which is looking forward for Thrive Year 7. So please go ahead.
Okay, morning everyone. I'm just setting up my screen to share it. Okay, so morning. So I'm Abina, so I'm part of the public health team, and I coordinate the activities that happen with Thrive Plymouth and the network, and engage them in our annual campaigns. So I'm just going to briefly go through what the theme of the year is today and sort of the rationale behind it, and also the activities that have happened already, so the launch and workshops, and what's planned for the future. And I think some of it might answer some of the questions that were had just a moment ago. So obviously the DPH's report touched on the picture in Plymouth and what happened in terms of Thrive being on hold. And I guess with COVID-19, not only were there impacts in terms of our ability to live well, and the things that we usually do, the way that we work and how we connect with people and spaces, we also experience our own sort of personal losses, so losses of relationship, contact time, as well as what was described earlier, the trauma as well of COVID. So we really thought that it would be important to take a year to really listen and reconnect to people. In terms of the Thrive Network itself, there was a lot of disconnection because of obviously it being on hold. So, you know, there really needs to be an effort to bring us all back to work together again and work as partners. And whilst there were things that happened that were negative, there was also a really strong response of communities coming together. And also recognizing that people did do things to stay well and stay connected. So it's also about us trying to capture those going forward. So what we want to do this year really is to regroup, as Rob described. We believe as a compassionate city that it's important that we acknowledge what we've been through and those experiences, particularly with the trauma that people might have experienced, and make sure that we're hosting a space for people to be heard and listened to. And for that to be part of building again on our health and well-being. And then it's about us trying to get back to what Thrive was all about and consider the things or the impacts that happened over the pandemic. If there were negative things, how do we as a network sort of work together to address those? Maybe not in this year, but maybe in future years. Some of the information that we find out might inform future years, but also how do we embed and celebrate the positive things and make sure that there isn't an inequality or people aren't left behind? So if there were positive things, how do we make sure that that's sort of seeded through the whole city? So this year is about us listening and reconnecting. So that's bringing together the network as well as partners reconnecting, and also reconnecting to people around us as well. So our launch happened in May. We had an online launch, interestingly, to try and bring as many people together as possible, and trying to sort of reinvigorate that energy. And this year we made a concerted effort not just to invite health and social care or voluntary services, but to look further afield into businesses, schools. So all of our sort of network connections or all of our assets within the city. And that was well attended. I think over 100 people sort of dropped in and out of the sessions. And we wanted to really reflect or mirror what we want the year to be about. So we began the sort of morning reflecting on our pandemic reflections and had our key partners present some of the challenges that they went through COVID, but also some of the things that were positive that they felt enabled their health and well-being. So we had primary care present a presentation to talk about the workforce impact of COVID, how they together as a workforce sort of connected and stayed well through that time. We had a presentation from Trevi, who talked about the impacts to vulnerable women that experience multiple disadvantages. And they talked about how they had to adapt some of their services to ensure that they were still able to reach the women that needed their support. We also had a presentation from the Youth Parliament, who sort of collated some of the young people's experiences. Their experiences spoke a lot about loss of friendships, time to build life skills, so workplace sort of confidence around employment and that sort of thing, things that they need for the future. And they talked a lot about the loneliness that they experienced, obviously not being able to be in school or be around their friends. And going forward, they also spoke about not being able to go to their normal activities and clubs, and some of those haven't restarted. So it's that we want to learn from conversations. You know, if there are things that make people well, is there a disparity in terms of how that's being experienced in the city? Are there clubs and activities and things that aren't happening for young people in certain areas? Are some opening up and others not? But in their presentation, they also spoke about their own resilience and having to grow up and support themselves and growing in confidence. So again, that might be something to build upon, as well as trying to connect through, you know, walking and doing different physical activities to try and stay well. And then our last presentation was around mutual aid groups. So we saw a big response from lots of communities that weren't necessarily formal volunteering services, and how they supported each other and how they came together and learnt more about their community and sort of built up that community resilience, which is a great learning and something that I think will hopefully continue on as a sort of positive thing from COVID. So at the launch, we also put up a whiteboard to enable delegates to interact and share some of their own reflections. And I've color-coded some of them just because already you can sort of see themes in having some of these conversations. And the question was, what enabled your health and well-being during that time? And some of the things that enabled their well-being were around outdoor space, so having access to outdoor space, being able to connect with people and exercise. So it's almost like a double-pronged approach in terms of those lifestyle and well-being things that we want to try and improve. We do know that through other work that we have done that this is a privileged thing. So there were some people in the city that don't always have access to indoor spaces. So again, as things open up, we want to make sure that the inequality is reduced around accessing outdoor spaces if those are the things that support people's wellness. Having a sense of purpose was also mentioned. And again, this might inform our approaches for future years, because we know that you know, mutual aid and volunteering also supports health and well-being, not just through sort of giving back to other people, but the act of actually doing and being out and about. And just to highlight a couple more, there was talk around workplaces being a supportive environment for people to be creative and think of how they will support some of the people in the city. And then the blue ones highlighted some of the things that young people were saying, which again touched on lots of social media use, which they felt led to loneliness and depression. And they highlighted some of the things that they would like to see around support for them. So around using peer mentors and also thinking about out of school provision. So, you know, when you aren't around those sort of supportive networks, who are the other people that you can sort of reach out to support your health and well-being. And then we went on to what we actually wanted to focus on, which was around the listening and reconnecting. And the idea around these presentations at the launch were to showcase some of the local approaches that are being used to listen and connect. And those that work locally and have made efforts to improve well-being. So we had 4 key sort of presentations or models that were showcased to us. One was from Livewell, and that was around motivational interviewing and solutions-focused therapy. And those are basically behaviour change tools that are evidence-based in supporting people to make the changes that they want to see. And as Rob sort of described, looking at a whole person, so not just focusing on telling people what to do, but trying to empower them to make the changes that they want to see. Our Space were involved in one of our presentations. So Our Space is an arts program which uses theatre and performance to build confidence and skills in people that experience homelessness, may have substance misuse issues or other mental health issues. And they're a great service that have been running for 12 years, and they link into Theatre Royal. And again, with those groups of people, those are people that are more likely to experience health inequalities in the city. And these programs have helped them build their confidence to articulate some of the things that they've been through in terms of their health, and then also has helped them to engage with other wider services which support them making positive changes in terms of their health and well-being. And it's also a great project that's helped them also gain employment. So if we think about the things that help us stay well, so the wider sort of determinants, we call them, you know, having employment and things like that, are very helpful in terms of making sure that we stay healthy. The next approach that we modelled was around appreciative inquiry. So that was delivered by Belonging Plymouth and also our public health teams. So this is something that we're widely trying to promote in terms of listening to people's lived experiences to try and shape how our health systems work, and trying to get them to work so they are of value to the people that use them. And that's just listening to everyday people and making the changes that we need to benefit those people. And we've used appreciative inquiry to make changes around the provision of obesity support services, around COVID messaging, and also smoking prevention, and trying to encourage people to use outdoor spaces. And then the last model was around Plymouth Compassionate City, which looks at compassionate networks and how you can listen and offer support to people within our health and wellbeing hubs in the city and provide those spaces. And this was important, I guess, to focus on the fact that we have experienced loss and bereavements, especially in ways that we wouldn't have before with the lockdowns and things. So again, it was trying to model that and I guess get people to start thinking about how we can build that listening capacity within the city, and how you can start to reconnect with people around you and bring all of these approaches within organisations and within communities. So our with Thrive Plymouth, what we usually have each year with our campaign is an offer and an ask. So our offers were modelled on those listening models. So we had free training and workshops offered to all of the Thrive Network members and all of the people that attended the launch. So again, it was appreciative inquiry training, compassionate friends awareness, motivational interviewing, and all of the other sort of listening models. The week of the launch was actually a mental health awareness week, and there was a public health campaign around lifting people out of loneliness, which we also offered and shared, and that had tips around how you can reconnect with people that are lonely and isolated. And then our offer also included our normal things around meeting as a network and reconnecting and so on and so forth, and supporting people with their own sort of actions. And I guess the ask was, can you take some of this into your own spaces? Can you join the Thrive Network and support us in terms of how we address health inequalities in the city? Can you share some of those campaign tips? And can you start providing those safe spaces for people to have that conversation and reflection and connecting? At the end, we always ask people to make pledges, and a lot of the pledges were around providing those spaces, going back into workplaces to do that reflection, as well as making sure that we are listening to our communities. So we have delivered our workshop. So that will happen following the launch, 3 weeks, over a period of 3 weeks. And we wanted to do these in physical spaces. So again, trying to encourage people to meet up face to face and reconnect in that way. And to do those in our wellbeing hubs to provide that sort of connection to wellbeing and to raise the profile of our wellbeing hubs. and a lot of good happened in terms of different services and organisations, as we said in the beginning, connecting with each other. For example, the youth offending team connecting with our space, Bernardos connecting with our space, around workplace wellbeing. So Babcock and City Bus, want to try and have conversations with the employees around improving health and wellbeing. A lot of the training was really valued because they were smaller organisations that ordinarily wouldn't be able to afford training like this. So to be able to have access to that was really useful for them, especially as a lot of them are having those important conversations on the ground as well. So our next steps really for us is to try and bring the network back together. There are some challenges in terms of people are used to working online, so I don't think you're necessarily going to get massive numbers of people working face to face, but I think it's trying to take that hybrid approach, so maybe doing some online stuff and also face to face stuff. Some of our people that have been trained in Appreciative Inquiry are also going to support us on a cardiovascular prevention project, which hopefully will look at what people value in their neighbourhoods and also how they see wellness. Some of the wider network are getting involved in trauma-informed approaches training, so they're helping us develop that for workplaces. And I think it's for us to continue collecting those stories and collating and learning. As Rob said, some of this will form what we decide to do in future years. If there needs to be a healing sort of time where we think of how we need to address some of the things that are raised through these conversations. And I think the Thrive Network meetings will provide a focus for that. So being able to look at what progress we're making on year 7, think about our health inequalities and things going forward and the impacts of COVID and the things that we want to celebrate and embed, but also maybe reflect on some of the progress on previous years as well. So I'll stop sharing my screen. There we go.
Thank you very much, Abs, for that comprehensive report. And I think we're all going to have our work cut out in the next few years to reduce health inequalities, which I fear we will find have been impacted adversely by 2 years of the COVID pandemic. So do I have any questions? Jemima.
It's just something that strikes me as how we as councillors, not just people who happen to be on the Health and Wellbeing Board or the Health Scrutiny Committee or things like that, how we can kind of engage with the Thrive programme in terms of our community role. The stuff you're working on around sharing stories and those kind of things. Have you got any thoughts about how we as councillors, as members, can kind of be ambassadors for the Thrive work? I hope that makes sense. I know what I mean. I'm not sure if I've described it properly.
I think you have, and I might be wrong, but in conversations, I don't know if previously some councillors have done appreciative inquiries before, so they've asked these questions. I've forgotten what service I don't know if that was when they were forming the Plymouth Alliance, or I can't remember, but it might even be that councillors engage in terms of collecting some stories. So councillors are great at speaking to people or speaking with people, and are good storytellers as well. So it might be that that's where the sort of strength and power lies with our councillors, that you could be part of the collection of stories and really listening to our communities. And I think you're probably doing it anyway, so why not sort of join the approach? So that's just my initial sort of thought.
Yeah, I agree with all that. I just wonder if there is something outside of here maybe that could be done. I know we have lots of things for councillors training, all that kind of thing, but something specific around Thrive and how we can engage with it and in it and take it back to our wards. And I don't know what you think, Chair, but I feel I found that really inspiring, and I know the meetings that I go to, I can bring it up, but actually just some, I don't know, bullet points or guidance or something that you could share with us to help us do that.
Yeah, sure. Yeah, I'll put that down as an action then. Yeah.
Thank you. Ross has just said to me, should we take that forward as a recommendation? So we will be doing that, because, you know, it's all good and well to talk about it in these four walls and beyond, but it's the much wider community that we need to stretch out to.
Yeah, I mean, just to add to that, I mean, I think what struck me today is I suddenly realised that, you know, Thrive Plymouth was established in 2014, and there's been a lot of churn probably on the council since that time. So it's probably important that maybe we as a public health team, you know, get the messages out to all of the councillors about what Thrive Plymouth is about and how we can help you and you can help us. Because as Abs quite rightly says, you've sort of got the finger on the pulse in terms of your the residents in your wards and in your neighbourhoods, and we need to benefit from that. So maybe I think we need to consider as a public health team whether we do some form of update on Thrive Plymouth to you know, to all of the councillors who may not be aware of the programme and haven't been on board since 2014.
Rob, I think that's fine. Ross would like to make a comment and suggest something.
Yeah, thank you, Chair. It's just to advise that, of course, we do have a programme of councillor development, and we can include that in our programme over the next couple of months. So we'll work with Rob to make sure that happens.
Thank you very much. Kathy?
Can I ask if Thrive Plymouth has a Facebook presence or a social media presence that we could share to people in our areas?
We don't have a Facebook, only because from experience, if the messages sort of come better when they're from our trusted voices, so who the community connects with. So sometimes if it comes from the council, it's not always the voice of influence, if that makes sense. So often when we give out messages and things, that's through our partners, and our partners have well-established sort of social media and things that could probably reach people better than we would. So maybe if I guess it might be developing bits of information, as Rob's saying, that could be shared on your own sort of platforms. So that could be part of the sort of key points that we put together.
Thank you. Any other questions? Well, I'd like to thank Rob and Abs for their reports this morning and the questioning that it has led to. So thank you very much for coming along and presenting the reports, and we will take that recommendation forward. Would people like a 5-minute comfort break? So shall we reassemble at 10:20? Thank you. Move on to item 10, Health and Care Skills Partnership Update. David McCauley, can I ask you to present the report, please?
Thank you, Chair. I refer to page 75 in the pack, if any people like to have a look at the slides. I won't go through them verbatim. I'm assuming everybody's had the opportunity to read them, but I'll try and pick out some of the salient bits. So, in very simple terms, workforce is a huge challenge to the system, the health and care system within Plymouth. Not just Plymouth. It's a national issue. But we've established a health and care skills partnership within Plymouth to try and address some of the issues locally that we're aware of. I think it's fair to say the partnership is a broad church of partners and includes everybody from training providers, the CCG or the clinical commissioning groups, so it'd be the Integrated Care Board, of course, colleagues from Live Well, City College, the hospital, the care homes, colleagues in domiciliary care, St Luke's Hospice, and that's just to mention a few, as well as the university, of course. So it's a broad church, and what we're trying to do is to develop a system-wide plan that picks up and addresses some of the key challenges that we're able to sort of try and do something about locally. So the work doesn't sit in isolation, of course. It's part of a wider Devon piece of work that sits under a workforce strategy that the CCG have been developing. So to date, we've already had some successes. As I say, we've been looking at how we prioritise the work, and obviously recruitment and retention is one of the key elements that we've been focusing on. PTC have been leading a recruitment campaign in social care and domiciliary care over recent months. And when we had the LGA review recently, that was described as inspirational and something that they've taken away to try and share with colleagues across the country. We've also established a forum with the unions locally, and the aim of that, and Anna attends that, is to try and pick up some of the retention issues that are affecting staff locally, and again, give us the evidence to be able to develop some interventions for that. We've also got other initiatives such as the availability of NVQ qualifications in care homes. And we've been doing an awful lot of engagement work as well. And one of the recent successes, I think, has been the Medifest event, which was attended by about 800 students. And the aim of that was, of course, to inspire them into wanting to work in health and care. And again, it's about sowing those seeds early. One of the other things that have been particularly successful was a joint bid with DWP. And out of that, we've appointed 2 health and care coordinators, and they work collaboratively both across the system, but also into the job centres. And to date, these figures that you'll see are probably already out of date, but about 3 weeks ago, we'd already recruited about 50 new people into health and care roles since February. We've also been looking at other opportunities. Obviously, the COVID testing regime came to an end in recent months, so we worked closely with the Lighthouse Lab in offering the people who were at risk of redundancy other posts within health and care, and that was quite successful. We're also developing a Plymouth Prospectus. So lots of partner organisations have done some really good work in terms of some good comms material and engagement material. And rather than sort of using that in isolation, we're trying to pull all that together into a single Plymouth-wide prospectus and approach. So in terms of some of the programme outputs, a lot of the work has been trying to, we describe it as knitting spaghetti or joining the dots. There's lots of initiatives happening across the city, and the strength of working together is that when we bring those together, we can have a lot more impact. And also we can look at some of the systems that affect the whole system and develop solutions. And to that end, we have pulled together 5 priorities. I won't go through them in detail, but you'll see those. The first one being gathering the intelligence we need, retention and recruitment, developing a sustainable pipeline. And again, that's about engagement, working with the schools and others in terms of making sure that people want to come into health and care careers and looking at how we make those more attractive. Priority 4 is around communication, and priority 5 is ensuring that there are, good enabling work that supports the delivery of the programme, such as e-rostering systems and stuff like that. So the next steps, as you'll see, we developed a fairly comprehensive plan. We're in the process of actually trying to prioritise that, i.e. just really describe what we're going to do in the short term, because we think there are, well, we know there are some high impact changes that we can make and make a real impact. And we're also looking at trying to allocate the work across the system because there's a lot to do, and you know there's it's about trying to share that work. One of the things we're working on, for example, at the moment is a recruitment event for September, and that's based on some work that UHP led last year, and it was very successful and managed to recruit quite a few healthcare assistants into the hospital. And what we're trying to do is to learn from that event, but spread it across the wider system, so it involves health, you know, the care homes, the dom care market, and also look at how we work across the system and enable people to develop really good career opportunities as a result of that. So I think that's probably picked up some of the main points. So open to questions.
Thank you, David. It's a very important issue as care workers are in short supply in this labour market issue that we have, and are very vital in keeping people at home, out of hospital, and also looking after people in our care centres. So thank you for that. What questions do I have? Kathy?
Have you identified why you've got this problem of 500, a shortage of 500 care workers? Is this short term or is this a long term problem?
I think Anna's going to pick that up, but
So thank you for that, Councillor Watkin. So I think it's fair to say workforce shortages across the care industry were pre-pandemic. Certainly what we've seen, you know, during the pandemic is you know, increased demand, which requires then additional workforce in order to manage that demand, as well as a loss of some workforce as well. And I think, you know, we shouldn't be surprised by that. We've heard from public health colleagues this morning the impact of the pandemic, you know, right the way across our society, and we're certainly seeing that in frontline staff who have worked incredibly hard over the last 2 years. So in terms of the 500 shortage, we have had shortages across the care market for quite some time. It has been worsened by the pandemic. And I think that, you know, as I sit here today, I can't say that we're going to resolve this quickly. I think what we absolutely have to do is that we have to look at how we inspire people to come into the world of care. It's hugely rewarding. But we need to really create a culture that this is a career with opportunities rather than a job. The labour market is incredibly competitive at the moment across all sectors. And you know, there are opportunities for people to move from care into other industries. So I think bringing together through the partnership all of the partners across the city and thinking very differently, not in an individual organisational level, but actually how we can create career pathways between care homes, between domiciliary care, between the hospital, between our community health and care provider into primary care and general practice is going to be really important as part of our long-term planning. So we're clearly doing lots to incentivise the market. You'll have seen through you know, full council, we've uplifted commission contracts across to the care market again this year. So an additional 10%'s gone out to domiciliary care. But I think what we're finding is that clearly some of the cost of living challenges are impacting on any increase. So I'd love to be able to sit here and say at a health and wellbeing board, this is short term and by Christmas all will be well. I think that's unrealistic, but I think, you know, what we have a commitment at place to do is to work in partnership to address the challenges and to look at the fact that we have a really vibrant city and it's a great place to come and live in and work in. And you know, we need to really make the most of the environment in which we have in Plymouth to encourage workforce to support and to fill some of the gaps that we have.
Thank you, Anna. Jemima.
Thank you. I've got two quick questions, if that's all right. The first one was around how you're linking in with existing Plymouth City Council initiatives like our skills launch pad and things like that. And the second one, you've sort of covered it, Anna, but just around incentives, because this is a challenge in every city, in every bit of the country. How kind of, I don't know, out of the box have we been in terms of incentives we can offer to people to come to Plymouth?
So I'll leave Dave to pick up the first bit in terms of Skills Launchpad, but just to assure colleagues here, absolutely working hand in glove with Skills Launchpad in terms of this. So clearly very aligned, and that was one of the reasons why we created the Skills Partnership, to make sure that we brought those elements together, because clearly there's opportunities around apprenticeship programs and those types of things. In relation to incentives, we are absolutely thinking outside of the box. So down to electric scooters, electric bikes, support with parking permits for city centre employees and those types of things. I think I would absolutely say, as I say to everyone, the team are very motivated to think outside of the box, and if councillor colleagues have thoughts, ideas, very, very receptive to those. We've got established forums across all of the provider market with our care homes, domiciliary care providers, supported living providers, and clearly we get a lot of feedback and intelligence from them. And we're very receptive to considering, we've supported with accommodation for workers coming to the city and all of those types of things. So we're trying to ensure that this is cross-organisational but also cross-departmental from a council perspective, because I think it's clearly the workforce challenge for all of us is one of the biggest areas that we'll need to address. So Councillor Lang, if there are ideas that you have or that your colleagues have, again, very, very receptive to that. Just drop me an email with anything mad and crazy that might very receptive.
Thanks. I was just going to add, if that's okay, Chair. In terms of Skills Launchpad, Plymouth, we've been working really, really closely with colleagues who have led that, and there's some shared resource across that. So the two health and care skills coordinators that I mentioned, they're based within actually Skills Launchpad, and line managed through that route. So what we're trying to do is to learn from the really good work that happened within Building Plymouth, for example, and share that across health and care, because some of the principles apply more widely.
Thank you. Can I just ask you to comment on priority 3, which involves recruiting people in the pipeline to health and social care, particularly with schools? I mean, we have Scott Healthcare College, which is in Jemima Lang's ward. So presumably there are very close links there, but you also say that there are proud to care ambassadors in every school. Perhaps could you tell us a little bit more about that, and how we're encouraging people to look at this as a career in various aspects of healthcare?
Thank you, Chair. So the engagement work is one of the key planks of this programme, and I guess the principle around early engagement is one that we're following. So the two health and care coordinators that I mentioned that we were fortunate enough to be successful in recruiting, they have a programme of engagement into schools, and Scott College, of course, being one of those. But again, it's about getting in early. It's about talking to them at an early opportunity, getting them excited with materials and thoughts and ideas about how health and care careers are the first choice for them, really, above anything else. And the Proud to Care Ambassadors, just to mention that's a scheme that's been running for a number of years now. And the aim again was to identify a champion within each education institution that could shout about health and care careers. And we're trying to build on that with the additional resource we have, and with quite a focused and targeted engagement programme.
Thank you. Any other questions? If not, can I thank you for the report, and David, and can we note the report, please? Item 11 is also you. So the integration white paper, if you'd like to take us through it, please.
Thanks again, Chair. This is a fairly brief summary. It's just to bring members up to date with some changes that are being proposed nationally and the implications locally of those. So the Department of Health and Social Care published a white paper in February called Joining Up Care for People, Places and Populations. And the aim really is to develop partnerships at place level. And of course, within this context, Plymouth is the geographical footprint. And it sets out a fairly ambitious programme of work. So if you look at slide number 3 within the pack that I've shared with you, there are a number of areas there. So there's shared outcomes, leadership, accountability and finance, there's digital and data, health and care workforce and carers, obviously some crossover with what we've just been talking about, and the impact on people. And then there's a programme over the next few years to deliver that. And what that means for us is that we will need to strengthen our local leadership. So, for example, there will be an individual locally who will be accountable for health and care delivery and planning. We will have autonomy delegated to us from the Integrated Care Board around some of those functions. We're currently going through a programme at the moment of looking at where our gaps are. So we've completed work on maturity areas, which in very simple terms, just, it's a bit of an audit in terms of where we are against best practice. And actually within Plymouth, we've come out relatively well because we've been doing some work on this, as you'll be aware, for a number of months. There's some difficult areas, such as digital. So one of the key planks is to develop a health and care record. Over a period of time, we'll have the systems and structures locally to be able to pick up and deliver the delivery of health and care for our local population. So at the moment, as I say, we're in the development phase. The next element of the work programme will be looking at the shadow arrangements, and then by April 2024 we'll be fully operational. And in fact, in the next few weeks there are some what they're calling accelerator events that have been hosted by the Integrated Care Board to help further this work. So I don't think there's anything more to add. So again, I'll open up to questions.
Thank you. Any questions? Nope. It appears not, so thank you for the report, and we will note it. Item 12, Health and Care Act briefing. And not everyone may have had the chance to read it, as I'm grateful for my 2 councillor colleagues for standing in at very short notice. We're not having a presentation on it, but while people might be thinking of any questions, do you, Ross or Anna, want to say anything? Maybe not.
I think it's probably important to reflect that the context in which the Health and Wellbeing Board is operating is changing significantly and quite quickly. The integrated care system should be up and running, I believe, from tomorrow was the plan, and I assume that's still the case. So the CCG will no longer be in existence, and we'll have a new integrated care system. The paper outlines the various elements of the Act which has enabled that to take place. I think it's a pretty detailed brief. So if members have any particular questions, we'll happily take them. I think it's quite useful. This does support the session that we provided all councillors with, I think it was 2 weeks ago now, where Jane Milligan and Sarah Wollaston provided a presentation on what was happening in the NHS and what would be ongoing over the next year. So I think that's fair to say. Anna, if you've got anything extra.
Nothing particularly extra other than I think, as Ross has said, the landscape in which we're operating on is under significant change at the moment. And I think, it's a paper that just illustrates that in quite a concise and hopefully comprehensive way. But probably in terms of my career, it feels that there is more change in terms of the landscape than there has been for many, many years. And I think, it then provides us with the opportunity, but also the need to review some of our local governance arrangements and architecture to ensure that we have the right mechanisms and that we're fit for purpose in that respect.
Ross, thank you, Anna. Does Ross, do you want to come back in?
I think only to say that the briefing paper does include reference to the health and wellbeing strategy locally, and how that might fit into the new world of integrated care systems. In particular, it highlights how commissioners will need to take into account the joint health and wellbeing strategy, which is agreed by this committee and by the council. And that we should expect our NHS partners through the ICB to come to us in the future with a plan, which will need to reflect some of those priorities. So it's just to put that marker up for the board over the next year. I think, to be honest, Chair, I think that's all we need to say. So happy to move on.
And I have my first One Devon Integrated Care Partnership meeting next Thursday. So. That will be interesting. Jemima.
Yeah, it's just around the duty to consult. So it says the Act extends this to include carers and representatives of people receiving a service or who may do so. Do you know if that would extend to us as corporate parents?
I don't think so. Would need to refer to the Act, to be honest, Jemima, to make that clarification. We'll certainly look into that for you.
Thank you.
Any other questions? Thank you. So we're not really even noting this, are we? Or we recorded in the minutes anyway. So thank you for answering the questions. And now we come on to item 13, terms of reference review. I think the last item leads into this quite neatly, Ross.
Yeah, I think so, Chair. To be honest, I don't think we were expecting to hold much in the way of a discussion on the terms of reference at this moment. But given what you've got there in the Care Act, Health and Care Act briefing, the integration white paper, just adds to the requirement, I think, for this board to have another look at its terms of reference along with its membership. And the role that it expects to perform in the sort of wider system. It's good to know, Chair, that you'll be at the ICP next week. It would be useful to get some feedback from that. But certainly, I think what we would hope to do going forward is to grab a small subset of the membership of this board to look at our terms of reference and come back with an updated version at the next meeting of the board.
Thank you, Ross. Yes, it's encouraging that the first ICP meeting is actually being held in Plymouth in this room next Thursday. So we are on the map in the whole of Devon. So thank you. Any other questions? We will note that as well. And then we come on to work programme, item 14. I mean, our next meeting is on the 29th of September. There are certainly things coming that I know are coming. The pharmaceutical needs assessment has to come. In fact, we've adjusted the date to enable the consultation on that to be completed. So we've gone back to the 29th of September. What else might we be bringing forward? The South West Ambulance Service is something that I think might be fairly important at this stage. Have you any idea what might come forward, Ross?
No.
No. Mental health.
Well, certainly the pharmaceutical needs assessment for September, I think we'll need to include the revised terms of reference for this committee in September. Other than that, I think it's up to you, Chair, if there's particular issues that the board would like to review. And certainly I think it might be useful post-scrutiny to come back around the urgent care system and give an update concerning scrutiny's findings in relation to that, and how the Health and Wellbeing Board may influence colleagues with any recommendations from scrutiny.
Yes, I mean, I think that will come back, and that might link in with the South West Ambulance Service, but mental health might also seem to be a priority if Liv Will might be able to bring forward those reports. But obviously, we don't want too crowded a meeting because we want to give every item due attention. But
Chair, I think Sheila would like to come in.
Thank you, Sheila.
Thank you, Chair. Yes, I wondered whether the board might be interested in the primary care strategy, which will be published sometime over the summer, the CCG's, excuse me, primary care strategy, which is currently in preparation.
I think that will be very interesting. So do you think that could come to the September meeting?
I believe it will have been published by then, so yes. Although it's not in my gift, but we can certainly make that request.
Okay, well, between the items that we've mentioned today, hopefully we will have enough to fill an agenda, I'm sure, for the 30th of September. Has anyone else any other burning issues they might want to bring forward? Not just council members, but anyone who's in the meeting? No, well, we will bring forward a selection of the items that we have discussed. So that brings us to the end of the morning. I'd like to thank everyone who's presented, often standing in for other people who've prepared reports, whom we must thank and aren't able to be here, and also to my two councillor colleagues who've stood in at short notice to be here and have asked some pertinent questions. So thank you very much and enjoy the rest of the day.